We're back, Boss Lady Live, 4th season. Can you believe it? My name is Sandra Samuels, CEO of Totally Male, and we'll be back Monday, October 25th at 8 p.m. sharp at youtube.com/The Totally Male. See you then.
Hi, good evening. Welcome to Boss Lady Live. I'm going to give a few minutes as usual for our folks to join. How was your week last week? Hope everyone had a wonderful week last week. This evening, like every other Monday evening, we'll be giving a lot of information, important information, and this evening we are speaking about healthcare and kids, and you know how important that is. Taking care of the children, knowing what signs to look for, what's the most prevalent health challenge out there for kids. And if you have any questions, remember, you can either send it to us by Facebook, that's either on my page, Samuel Sandra, or you can send it to Totally Male Spa, or online YouTube, which has the link. There's a link right there on the page, www.youtube.com/The Totally Male. I don't see anybody saying hi this evening. Tell me how was your week? Did you have a wonderful week last week? How did last week go? Say hi, man. Let me know that you're there. I have 3 persons online, but nobody's telling me hi this evening. All right, so in the interim, in the interest of time, because you know we have another expert with us this evening, Dr. Carolin Thomas Boyd, and she is a pediatrician. She has been, although she looks like 12, don't let the look fool you. She is in the business of pediatrics for 24 years. She's a mother of 2 adult children. Anna 23 and Alex 20. So you know she's not as young as she seems. Presently, she works at Winchester Surgical and Medical Institute, and her hobbies include singing, playing the piano, and reading. Welcome, Carolin.
Thank you very much, Sandra. It's a
my friend, my singing mate.
Yeah.
We went to school together. We have known each other from what I'm saying in Jamaica, from your eye there, your knee. I have known her almost all my life. Hi, Shelly. Good night, my darling. Who's calling me on my phone? Anyway, so tonight we will be speaking. Well, first of all, tell us a little bit more about yourself, Carolin. Just give the people an overview of why you chose pediatrics. Why pediatrics? Just give us a little overview on this.
The funny thing is, I had wanted to be a dentist. I wanted to be a dentist, and when I told my mother, she told me that I must try my head right up for university there, because she have 3 more hungry belly people to feed, and she can't send me a fine. So medicine not too far. So I went into medicine, and I was encouraged to do so because the Trinidad school, university was to open a school of dentistry in Trinidad. But that didn't happen until the year I graduated, at which point I didn't want to be studying again. Anyhow, by the end of internship was 18 months. I did my internship at Spanish Town Hospital, did pediatrics out there, and then came and did 3 more months at Bustamante. And I just fell in love with the kids. I just say, I could really, because with kids, you just have to understand them. You just have to tune in, and they can't tell you what's wrong with them. You just have to just zone in, and So I think pediatrics chose me. And with my present, I mean, people who know me, my personality just goes very well along with it. So before I knew it, I mean, all these years have passed. I enjoy it every day. I mean, I did 10 years in a government service. And then I worked at Kids Clinic for some time. And then I've been at Winchester now for 10 years. So, and I like private practice because I get to know my patients and I develop a relationship with them. Bosomanti was okay, but I never see the same person twice. And Bosomanti casualty, I didn't feel I was maximizing my true calling because it was just like next, you're just trying to get through the load, and that was just not me. So after a few years, I decided that no, for me to be who I think, I know my whole calling is evolving because in my office so often I have to connect with mothers on a different level. And, you know, being a parent myself, there are many other things besides what's ailing the child at the point.
Absolutely. So you're more prefer that personal touch.
Yes. Yes.
Right. More of a relationship building.
Right. Yes.
Kind of practice rather
Not
than
mechanical. Yeah, man. Yeah.
Right. I can totally relate. And that's exactly what I like about my business, that relationship building that you do on a day-to-day basis. Absolutely. So tell us, first of all, you know, kids have been in the news quite a bit, especially during COVID. But what I want to hear from you before we go into the whole COVID and the whole abuse situation that's going on now, that's really a priority, I think, for the government and from Cisco, right? What are the most common ailments you see coming into your office on a daily basis?
You mean regular illnesses you're talking about?
Like if you had a scale of 1 to 10, what are the most common things persons come in to see you for? What would they come in to see you for?
Well, fevers, cough and cold. It depends. The younger mothers and with the younger babies will come for a runny nose and cough. That's bread and butter, really.
And you see from what age to what age?
Oh man, 0 to 19 years.
Okay.
Yeah. The thing is, between 12 and 19, the child doesn't belong to anybody. In that, the adult physicians are afraid of them, and they're not, you know, that's the adolescent age group. There's something called adolescent medicine. There's one of my colleagues that did adolescent medicine as a specialty, but most of us general pediatricians will still look after them. And teenagers are a special age, trust me, because it's like you have to know your child all over again. So, but generally, initially I see them a lot for well baby checkups and vaccinations, and you know, they don't really start to get sick until like the toddler stage when they start to go out to preschool.
Right.
And I mean, there's asthma, eczema, gastroenteritis, you know, sore throat, ear infections, those kind of things. Now that COVID is around, I mean, there's such a low threshold. Parents are jittery. But I try to do a lot of on the phone call. I say, you don't really have to come for, you know, don't come unnecessarily. If the child is not exposed to a contact, the child just has a cold. Cold still asleep. You know, the regular one. So,
yes.
Yeah. There was a time when we had hand, foot, and mouth. That was a big thing, which is when you get blisters on the palms and the soles and in the mouth. That's a self-limited childhood common illness, which occurs in children, mainly those less than 5. You know, bigger children don't get it. So, you know, I had a mother once, her 3 kids, twins. She had twins, 4-year-old twins and a 2-year-old, and all of them got it from a mutual cousin.
Wow.
Unfortunately, that it was at a family, and she was not a doctor. The husband was a doctor, and she blamed her husband because him never catch it. She ended up catching it, even though adults don't usually catch it, but 3 children had it all at once. So, you know, but those things are self-limiting for the most part. So.
All right. I know, like, when children are born, you're going for your checkup and, you know, the various different times until it gets to a certain age, they kind of stop going to the doctor, pretty much.
They go less often. You really should get the annual.
Do you find mothers taking in kids for regular checkups, or it's just when something happens?
Mostly when something happens. But
Right.
the recent trend now is a back to school, because some schools are insisting on a back to school, and especially now with COVID, a back to school checkup. So this year I had a lot of back to school. I mean, the popular time when to catch them is when they're going in for the first time, being at toddler stage, then at grade 1, then high school, then university. And each time when they come in, those are special points. You do a checkup with the vaccine. I mean, I had a child this year. Oh my gosh, she never get any vaccine from she was 4 months. I had to ask where the mother put her if she was under a rock. The poor thing is that she was the last of 4. And I guess, we have the next child. And because you did do it already, that poor little one just seemed to have fallen through the cracks. So I have to give her several shots to bring her up to speed and follow up ones.
Wow.
But the first child gets everything because they don't miss an appointment. But the second child, all right, that's so it. By the time you reach the third child, all right, I'm going to do it. By the time you reach the fourth child, well, it's whenever you have the time. Sadly. Yeah, but anyways.
That's dangerous, though.
Yes, but initially,
so I mean. Are not followed up at school?
I don't know how that happened, because usually before you go in, you are supposed to bring in your immunization card and so on. But depending on who the parent is, I find sometimes, because I see parents come in, they plan to do it, they beg the teacher apply, and then if you don't have someone to follow up, they just get forgotten and then stay under the radar. It doesn't happen very often. No. It doesn't. It should not happen. So, yeah.
Okay. Right. So, all right. So those are like general stuff that they come in for.
Right.
All right. So what I would like for you to touch on a little bit is how to identify kids that may be having a hearing problem, or they're not seeing properly. Okay. What are some of the signs? What are some of the symptoms? Okay. Because I think a lot of, now that I am now familiar with like autism and all of those things, a lot of those things kind of get missed sometimes until very late. Right. What are some of those signs and symptoms that parents need to be looking for with their children to ensure that these things are caught before it's too late?
Well, first of all, when they come into the doctor, it's early on. It's like every 2 months, 2 months, 4 months, 6 months, 9 months, 12 months, and then 18 months, 15 months, 18 months, 2 years. So as you get older, it's every 2 months, then every 3 months, then 6 months, and then after 2, it's yearly. But every time we come to the doctor, we assess the weight and the height and the head circumference. Is the head growing too big? Is the head not growing at all? And then there are milestones. You should be, have head neck control. You should sit up at a certain age, pull to stand at a certain age. So that's gross motor skills. And then comes the babbling and the language and so on. So initially, what you're looking at is that the motors, oh, my baby not sitting up yet. That's a big thing. I mean, they complain about teeth, but teeth is not important. I mean, it's not crucial because you're going to get the teeth most of the time. But if a child reaches 9 months and is not sitting up, that's a problem, or still have a floppy head. The other thing, early on, at the earliest stage, like before 6 weeks, is the child seeing? They will follow you. You'll see the eyes, following, and then they should respond. If a door slam, they should jump. I mean, because in our society, we don't have formal sight and hearing. In the States, they do all that and so on. But we have more crude measures. So if they are low noise, they're supposed to get frightened and cry because door slam or something. So that's a good way of telling the child is hearing. The seeing is easy because they will squint. Newborns don't like bright light. But if you find that the child's eyes is roaming, not fixing on anything, then you have to wonder the child is actually seeing.
Right.
We can do hearing tests on small children, but that would usually, like for instance, if they were sick in a newborn and had to be in a nursery, had meningitis or on certain drugs and so on, there is something called an auditory brain response, which you can subjectively. The child doesn't have to respond. You can measure the hearing, but it's not routinely done. It's only if you had a issue. And so but going further now. So when you reach one, they're walking. Then the babbling starts, and then the language. The thing about autism is that you cannot diagnose it less than 12 months. Most times you really by the time there might be 18 months to 2 years, because it's really a problem with their social skills and communication and speech, so on. So their whole behavior, social interaction, and so on. So it's only when they should move on to the next stage and they're not doing it that now you begin to wonder. And some parents are in denial, and they say, "Oh, it's so their mother, father, sister, brother, somebody in the family never talked till he was 3," and they ignore it. But really and truly, you can't really beat up yourself, because you can't really tell for sure when you're less than 2. It's just when it gets to by age 3, really there's certain things that the child should be doing, and they're not doing, and then I've seen children.
I'm sure that would apply also to any other kind of mental issues, like well, I suppose being dyslexic, you would know until a child needs to read or write. Am I correct?
Yeah, dyslexia is later, because that is how you process.
Right.
One of my siblings actually was diagnosed with that, and my mother, who's a teacher, is the one who discovered it, really. But there's so much help for children like that, really. He did very well.
I don't think it's a diagnosis, though, is the problem, because I can think of quite a few people that I know when I was growing up, that they were just sent to regular school, regular class. No checks were done, no diagnosis was made. They're flunking out of school, and you just say, "Boy, the kid just lazy." Those are some of the things that, knowing what I know now, if we had the knowledge of, okay, when you see somebody doing this, you need to take the child in or get it investigated. I'm more looking for preventative measures. More, when I say preventative, meaning make it go through the whole of them lifetime.
Well, as a parent, you have to really be alert.
Right.
The onus shouldn't be on the mother only, but the parent. But sometimes it's and then the teacher. Teachers, I always say they're born and not made, because some teachers should not be teaching. Many times a teacher is what really, because parents are hustling. They leave the child with some cousin. They try to make ends meet, so they don't really. That's one thing. But sometimes I find, though, the parents, depend on their education level. They might not. When I was at Boston one day, I remember in the clinic, I said, "What school does this child go to?" He was about 7. Love that time, no go school. I'm like, why? Lord, he can't learn, him head too tough. And that is her. That's the end of her. Every child can learn, though.
Right.
So,
and what challenges the child is having.
Yeah, and there are many ways to teach. So you have to find out how the child can learn, and then.
So her solution was not to send him to school, none at all.
She done with it, which is unfortunate. Then you grow up with an adult that's illiterate, and it doesn't have to be the end at all. I always say maximize the child potential, maximize whatever the child needs. You find the fit after doing your investigations, being assessed or whatever, and work with what God give you.
Right. All right. So is there any other exploration that, let's say, a child from 0 to 1 to 0 to 12, the preteens, any investigations that persons don't really not necessarily come in on a regular basis for, that they really should be doing? Is there any investigative anything that parents should be doing from a child 0 to 12? Want to
It
be with
depends. If you have a concern about language or behavior, I always encourage them to enroll them. Like by the time they're 2, then you see how they do over the next 6 months. It's an observation thing now, So
right.
I mean, early more major things like a big head and so on, you'd have done cranial ultrasound or CT scan, or that is, they base the child not sitting up, then you have to check the neurological background as to why and so on. And then that ties into birth history. Was it a traumatic delivery? Did the baby come up with APGAR, good, what we call an APGAR score, which is out of 10? That has to do with if the baby breathed, cried, was blue. The newborn period, did the baby have meningitis when it born, all kind of things. So if you have a stormy perinatal period and you're sick in the nursery for like 3 weeks, then you might have to do an early cranial ultrasound and CT scan, and then you monitor that child. Baby will have seizures, EEG, and but the doctor should guide you depending. Sometimes the child looks perfectly normal, and then there's still problems inside, but you won't know. I mean, if the CT scan might look normal, but it's just that the child either retarded, is a slow learner, learning disability, ADHD, all kind of, there's very myriad. The whole thing is that as a parent, you need to be alert. I say, okay, something is amiss. You take the child to the doctor, and then usually, physically they might look okay. If that's the case, there are developmental tests that you can do to say, and there are a few places where that can be done. It's just that I find that our resources are limited. So you might go, you refer them, because I'm a general pediatrician. There are 2 developmental pediatricians in the island at the moment. There are a few speech therapists, not enough. So if they need speech therapy, the appointment is, far. And if they need to be assessed, that's far. I had one parent who had the wherewithal, she just took the child away. It was a girl, and I thought she was autistic. And autism is much more common in boys than in girls. I was on a ratio of 4 to 1.
Is there a medical reason for that?
No.
Okay.
In fact, they think it might be genetic. Now, for years, the MMR got blamed. Oh, I'm not doing the MMR because.
What is the MMR?
Sorry, measles, mumps, and rubella.
Oh, the vaccine,
which is done when you're 1 year old. So you get other vaccines, but when you're 1, you get MMR. That's a 1 year old thing. So for years, and people have shown me studies, they think that the MMR cause it. The MMR cannot make you autistic. Otherwise, all of us would be autistic. Because all of us get MMR, measles specifically. So it's not really even the MMR, it's measles, the measles vaccine that get blamed for it. No, I'm saying if that was the case, then every single person who got measles should be autistic. To me,
so some people could not have a negative reaction to it.
Not to make
like
you autistic.
Some of the medications.
No, but not to affect your brain in a way that makes you autistic. It's a complex disorder.
Okay.
There has to be some genetic and environmental factors, really. It goes across all socioeconomic and ethnic. It's not particular to the Chinese or the Indians or the Africans. Anybody.
Right.
Yeah. So, and I've had parents who tell me they don't want the MMR, the measles, and I give them time to make up their mind. When the child reached 3, I say, okay, it's clear this child is not. It's not going to be. He's 3 and doing all manner of things. Can I give it to him? No.
Right.
I give parents a right to refuse because it's their child, But I try to, as much as possible, encourage, because the reason why we don't see measles is because everybody's vaccinated.
Right.
I had measles growing up. I had rubella growing up. I didn't have mumps. But the reason why, doctors who are studying today, sooner doctors, they don't know what this look like because we all have the shot.
Right.
And measles can cause encephalitis, and it can kill you, But we don't see that anymore.
Well, since we're on the subject of vaccine, we're in the pandemic, they're saying now that kids are to get the vaccination. What age is it recommended for children to now start getting the vaccination for COVID?
Well, the only vaccine that is authorized or approved, I should say, is a Pfizer vaccine, and that's approved for children between 12 and 19. They are doing studies for the 5 to 12-year-old, I know, but they have not made a decision yet. It's likely, from what I read, is that they will get a lower dose of the same Pfizer when they make up their mind. But right now, it's for the 12 and over.
Okay. So nobody below 12 is to be getting the vaccine.
Right.
Shireen is asking, who are the two developmental pediatricians?
Oh,
Dr. Garbot.
Dr. Andrea Garbot and Dr. Maureen Sams-Vaughan. Dr. Maureen Sams-Vaughan is on her McKinley Drive, Roosevelt, which was Roosevelt before.
Maureen Sams-Vaughan.
Yeah, Maureen Sams-Vaughan. She operates a place called One of a Kind Kids. And she's been in the business a long time. So she is the pioneer. And she has a whole outfit. So you can get referral, within her operation.
What Garbot is it?
Pardon me?
What Garbot is it?
Andrea Garbot. Andrea Garbot is at Kiddie Care Pediatricians, which is at 11 Latham Avenue. I know both of them fairly well, but Maureen is this, I guess, senior one. But right now, any one of them,
yeah.
You can get out earlier, but those, if I perceive a child that needs to be assessed, I'm gonna send them to one of them.
Okay. Yeah. All right. So we're moving on now from the preteens now to the teens, which is a whole nother level. Now, I don't recall ever.
Sandra, sorry. Yes. While you think about it, I have to plug in my laptop. Oops, I'm coming.
I saw it getting light and dark and light and dark.
Oh dear, I thought I had enough juice. I'm coming.
No problem. Yeah, so you heard that. Well, you can always get information from the video. It uploads on the both the page and on YouTube, so you can always get information. Anyone out there who needs to see the specialist, the information will be there. In Cuba, 4-year-old.
Yes.
You all right now? All right.
Yes,
so Carol is saying in Cuba, 4-year-olds are getting COVID-19. They're getting COVID, but kids are getting it. Oh, the kids are getting COVID-19 shots. Oh, she's really? Injection.
Unless that's a Cuban vaccine.
All right, so Carol, do you know what type it is? Can you let us know what type? If you know, because we're not giving it in Jamaica. Yeah. So as we were saying now, so from 12 now going up now into the teens, well, preteens and teens, from 12 going up or 11 going up. That's a whole nother ball game. Right. No, I can't recall my mother taking me unless something was wrong.
Right. True.
Right.
True.
So I think most of the checking and the rechecking and the follow up and those things are normal. I remember going to the dentist quite a bit with me very, very early age. But like in my teens, things kind of tapered off.
Right. Yes.
So I don't think it's a habit for our culture to take kids to the doctor unless something is wrong in the age group.
Right.
But then we're going to start our periods.
Right. Yes.
People start having sex. No conversation is really hard.
Right. Yes.
What is the age group really? I mean, now that all the information is out there. I spoke to one of my clients. He's about 16, because he's in sixth form. He's about 16, 17. I asked him if mommy and daddy have the sex conversation with him. He said no. So I said nothing at all. He said not really. So he said because no, I know. I said, but what does he know you know? So, some of those things, when are you supposed to have when are you supposed to have that talk with your kids? What are we to be talking about? And what are we supposed to be checking? And when should we be taking like an adolescence for checks to, especially when periods start and maybe they're having period issues, because sometimes they behave as if painful periods are normal,
Yeah.
right? Oh yeah, man, it's the time of your month. I remember my girlfriend used to have. I knew when it was her period because she would miss that day at school. Is that a normal thing? Should we take them in when that is happening? Give us some pointers as to what we should be doing. Like for teens and the preteens.
The thing is, well, the age of adult it varies
Boys
because
and girls.
sometimes, I mean, if you have a 9-year-old, that's a different, the 9-year-old is not ready. I mean, I've had mothers who get stressed out because it's so early. Then they
Right,
end up coming because then, they need the child needs more guidance because the body is ahead of the mind kind of thing. And then, but it is a normal thing. And I suppose you have to teach a child coping skills.
right.
And but as they get older, girls especially, the hormones and the mood swings and so I suppose I can't put an
Nobody
age.
has that conversation with us, Carlin.
Pardon me?
Nobody has that conversation about mood swings and those things. Do people really have
Yeah,
that conversation with their kids?
they don't. I mean, I remember in my personally, I tried with my daughter. Well, one day I said to her, which Anna am I getting today? The moody one, the sad one, the happy one. 'Cause I'm not so sure. Just let me
Yes.
know. And I had to tell her it's okay to feel this way, but the whole, you have to learn to manage it, and it's a part of growing up. And it's to me, I mean, when you're a parent, I mean, I always encourage my children. I say, I know you have friends, but try and you won't tell me everything, but I try to be as open as possible. Do not be afraid. I remember one day my daughter said to me, "Mommy, if you ever know what some of my friends were doing," I said, "Are you doing it too?" Because she said, no, no. I said, "Oh, I just check in, I just check in." But as a parent, it's so important for you to let your children know they can come to you. They won't tell you everything, but when it really matters, they will tell you. And but if they're afraid to tell you, you will be in big trouble because by the time you find out something, it might be gone down the wrong path. So that's what I have to encourage. But as far as when that time comes, the whole period thing, I remember telling my daughter, I said you have to be discreet. Everybody doesn't have to know. The next month she's locking the bathroom. I'm like, why are you locking the door? Mommy, you said nobody must know. I said, but I'm your mother. I need to know.
Right.
So and then I had to teach her to manage it because she shared the same bathroom as her brother, and then he was annoyed if the place is in a mess. So
Right.
that's personal hygiene comes in, and that sort of thing. So yeah, but too
So
many
what are
times.
some of the things that we should be checking for the preteens? Anything in particular apart from the whole period issue? Are there any irregularities that we should come to the doctor, bring the children in for?
Well,
Anything with regards to the puberty stage?
initially the periods might be irregular, which is normal. But if the
Nobody
period is
told
going
me
on.
that. Nobody told me that. How would I know?
Well, the thing is, no, usually the mother is uncomfortable with that. I will see such a child, but some mothers are okay and would they do. When we do the general checkup, I usually ask if the period has started and how regular it is, and if there are any painful issues with it and vomiting, and is the child missing school, because the whole point is to get to a stage where the child does not miss school. So I usually advise, look, you have to have the calendar, figure out what his cycle is. If it's 20, it could be every 21 to up to 35 days. You start taking the pain medicine like 24 hours before. If you try to be proactive, and then eat properly, get enough rest, exercise, those kind of things. So Yeah, so the mother needs to help the child to learn to manage it, so to speak, because she's gonna be doing it for a very long time. So, but no, they have apps on phones. I
Right.
mean, that was not our era. We had to
Mm-hmm.
go on the calendar and tick off the days. But I would say, I would say it here that irregularity is good. It's normal for 12, sometimes up to 2 years, and if you're an athlete, that is a problem. That sometimes disturbs any trauma, stress, people dying in the family that can throw your cycle off. It's just it's normal. I don't Boys don't go through that, but boys go through something. I don't even know what to call it because
Mm-hmm.
they're going through their hormonal changes as
Right.
well.
When the voice deepens and
And yes, yeah.
Mhm.
So and they have what's called a wet dream. My son
Mhm.
never did ever tell me. When that happened, but
Mhm.
you
But
know,
maybe you had that discussion with his dad.
well, I should hope so.
Yeah, well, that's what I'm saying. Some of these conversations, things just happen, or
Yes,
they
yes.
they 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 really try them sit down with them brethren and talk about it, and
Yes. I usually
So
ask
I'm saying,
what
are
they're
there some conversations that parents really need to be having with their kids at this stage instead
I
of just
think
leaving it to the
I
app
think
or
you need to.
the TV? Huh?
Yeah. No, I think you need to. So I usually
Mm-hmm.
check what it is they know. I check
Mm-hmm.
where the source is. Guidance counselor did some of it, what they know, and then what is the truth, kind of
Mm-hmm.
thing. So as a parent, we cannot be afraid to have those. As a mother, I did as much best I could with my son, from my,
Mm-hmm.
but there's some. I mean, I can remember when he was in the first home. That's the last time I saw him without. After first home, that's it. I said, "Boy, are you washing? Did you roll over the foreskin? Mommy, that's embarrassing." I said, "I need to know." I'm outside. I said,
Yes.
"Did you? You have to wash it properly when you bathe every time."
Right.
So it's just it's just a thing I encourage really. Too many times you just leave the child up.
Speaking about foreskin, like the tightness of the foreskin and stuff. I know of a few people who did it in their adulthood. Is it something that is still being practiced as young boys, or what
Are you
is
talking
there
about circumcision?
to circumcision versus no circumcision?
Oh, no, circumcision is not routinely done in this country. It's done as a matter of choice. But when the child gets to 1 year old, because before that you can't really roll back the foreskin, there's natural adhesions. Usually, the doctor, you should check for to see if it will at
When is a
least.
circumcision normally done? At birth?
The best time to do it is at birth, but that's usually at that point you can't tell who's gonna have problems. It's just that you have decided to do it, but it's an office procedure at that point. It's done on a local anesthetic, up to 6 weeks, depending on the size of the penis, because after that it gets too big and you cannot do it in the office, and then the pain fibers develop and the child will be in way more pain.
The
So
what
the
develop?
the
Oh,
pain
okay.
path, their pain threshold or the pain fibers or so they would feel more pain. But when they're in the newborn stage, it's just local. Let's strap them down and it's an office thing, easy cheesy. When
Mhm.
you're older, it's a day case. You have to now pay for theater and the surgeon assistant and anesthetist, and it costs way more.
So what would cause the penis, the foreskin to be tight?
Oh well, some
Mhm.
children are just born with. Rarely. I mean, I think it's only the doctor, me or the pediatric surgeon, if you cannot get it back. And you can apply a steroid cream for about 2 weeks, which usually helps to thin it. And then if that doesn't, if there's no other way, then that's the only way you should need circumcision, because as long as the foreskin can go back, medically there's no indication because you can hold
Mhm.
it back and wash it. It's only if it's so tight that it crack and tear every time. Then when it crack and tear every time, when it heal up back, it heal up. Scar is even tighter. So that yeah. But
That's some people.
yes. So usually, if you reach one, I usually test it at that point. If the creams still not doing it, I send it to the pediatric surgeon, and if they are not successful, then we advise circumcision. The only time is sometimes the parents, well, I guess they, people and the chloroform, and they don't want to put the child to sleep, and so they don't do anything about it quite. But if it's really for the best, if based on hygiene and so on, going as an adult, that you can get to that, head of the penis, either by rolling it back. If it can't go back, then you should really, because germs and stuff can collect there. And then there's
another conversation also that you should be having with your son.
Yes. Yeah, you mean about the hygiene and so on? Yes.
Absolutely.
Yes.
And I in one of my talks, I mean, the whole human papilloma virus conversation up, and that a lot of people didn't know that you could get that during oral sex and all of these things. These conversations, I don't think they are being had in the household. It's not something you generally read about. People don't necessarily seek that kind of knowledge, and then until something happens, and then this is when the conversation is had.
Right.
So does the pediatrician have a talk, or we know it's supposed to happen at home, but does the pediatrician, is it a part of your routine when a teenager comes in to you? You speak to them about the whole adolescence, getting into your sexuality, what you may be feeling, how to manage that is not something that's
not routine. No, not really. It depends. It depends if the visit is about that nature, like there's a discharge or something, or if the mother is concerned that the child is sexually active for whatever reason, then it goes there. But usually, and then I send the parent outside of the room, and then I have a one-on-one, because sometimes the child will not divulge to the mother.
Right, sitting right there, absolutely. That's not gonna happen.
Right.
Usually that won't happen.
Yeah.
Says, so if the steroid cream doesn't do the trick, so yes, I think she did say yes, circumcision is necessary.
Right. If we can't get it over, and the surgeon, if it can't, for the best,
Well, Carol did answer, and she said the name of the vaccine. It is Cuban, La Soberana, for kids 4 and up. So I suppose that's for Cuba. Well, her husband is Cuban, so that is right. So that is, I suppose. All right. So with regards to now, ages 10 and up or 11 and up, are there any particular types of illnesses, another top 10, that you see kids coming in with, that is something that you would want to discuss? Anything that's higher than normal when it comes to Jamaica? We just want to get a feel of what's happening. Anything in particular?
No. Most of our children are healthy, but what I'm seeing is anorexia in teenage girls.
Really?
Yeah, or depression, anxiety. Those are the things. They're mostly healthy for the most part. It's not, I can't say like, it's not like pneumonia, none of that. It's usually psychological. I've had in the recent past, at least 3, maybe in the last year, 3 girls who were just losing weight. They thought they were too fat, and then they were starving themselves, barely eating, and I had to send them to a dietitian, and then I had to send them to my adolescent pediatrician colleague, who is Dr. Abigail Harrison. because they were just dropping weight. So and it's a perception thing, the body image, more
Well,
in girls. Boys
Instagram will
don't have.
do that to you.
Pardon me?
Instagram will do that to you, especially when everybody has
Yeah.
a 22-inch waist.
Boy, it's
22-inch waist and a 45 or a 50 hip. Everybody's like this now.
hourglass. Yes, yes,
Hourglass.
yes.
Yeah. So I mean, I would hate to be a child now because I know it really is
Yes,
very rough out there. So
yes.
let us go into what is being, well, it's a challenge right now, I understand. Based on what I'm hearing on the news and what I'm reading in the newspaper, um, they said that child abuse has increased since the
COVID.
pandemic has started and the at-home learning is starting.
Yes.
Now, what are some of the signs, symptoms that person should be looking for um, at, with their children at home? Signs, symptoms, physically, mentally. What are some of the signs and symptoms that person, parents, guardians should be looking for that are generally telltale signs of some form of abuse? Because it doesn't have to be physical; it could be
Right,
some.
right.
Yes.
Um, well, they're not eating, or their mood change, depressed, sad all the time, acting out, aggressive. Um, um, well, I suppose it depends on the age of the child as well, because you see, if it's an older child, then they might be forced to try and hide it. Then they pretend everything is okay, but then the grades start suffering at school.
Great. Mhm.
Great, yeah, yeah.
Well,
Um, mm, I've the thing is, it depends. The younger ones now might not really, but when they come to see me, the younger, if it's a sexual thing, they will open their legs, or they're very withdrawn. Um, they just antisocial.
in
Don't
general.
yeah, yeah, yeah. The younger ones, the older
Mhm.
ones now is more complex, really. Um,
And
the
what
thing
is
is,
okay? And let's say someone comes into you with a child like that. What is the responsibility of the pediatrician, or is there a responsibility of the pediatrician?
so
I'm
if
asking because I have to just throw it out there, and
yeah,
I know
yeah,
that I just have to ask, what is the
yeah.
responsibility of the pediatrician? And
So
I mean, if there are no physical marks, let's say it's not rape per se, but it's some other, well, let's say vaginal rape. Let's say it's not vaginal rape, but it's something else. And
but
you see,
sometimes, yeah,
you have a
it might
conversation
not
with the child, or do you have a conversation with the mother or the parent?
with the child first. The thing is, sometimes it's not as traumatic as rape. Sometimes it's fondling, it's feeling up,
Right.
touching up, and children are very intelligent. They don't
Right.
have a 4-year old don't have any reason to make up. To me, the child is right until proven otherwise. They don't have any reason. I mean, I've recently had a little. Well, she was from St. Thomas, but the mother came because the police didn't believe her. And the little girl said so and so when he picked me up did this that that she could tell me. I mean, and it was the first time the mother was sending her with the driver of this taxi, and the little girl,
Mhm.
she was not traumatized. She was not. She'd allow me to examine her. There were no physical signs, but she complained the same evening to her mother that this happened.
Right.
And so I said, you have to do something about it, because the next time it might not be as benign.
Right.
Really. Man should be, and then it will be his word against it. But I mean, the 4-year-old has, I mean, I would have to believe. So I wrote a report. Then,
Mhm.
they have to go to Sissoko and then they take it from there. But it's my responsibility to report it.
Right.
Um,
So
but the
do
flip,
you, so because I know it's a very touchy situation.
yeah,
So
yeah.
once if the child says something to you, or you have picked up something, your next step is to what? To speak to the child or to call into SOCA? Speak to the
No.
parent or guardian, or you because suppose it's the parent.
Oh well. No, well, it's unlikely to be the parent that took the child to the
That is true.
years ago I had a 11-year-old that was really unfortunate. The mother took her because the child was just vomiting and she couldn't understand why, and the person might can't find out what wrong with her, and he's like the Lord said to me, do a pregnancy test. Lo and behold, it's positive. And the mother just
11?
yes, that was very traumatic for me too. But the thing is, and that took up the whole of my day now because they couldn't see nobody else come after start out this and one.
Right.
But the whole thing is that she came because the child was vomiting. She goes about to the GSAT. She's not focusing at school, and every morning she's sick. So something must do her. And then, but it didn't end well because the perpetrator was a stepfather. What it boiled down, and then, I mean, even though I referred when it came down to the fact that, oh, doc, if we cannot send her somewhere to cut dash for the belly, I'm like, what? Yeah, I said I cannot do that. I sent her to university for admission. Because that's my responsibility, and she was admitted and so on. But it's our society is something else because sometimes the mother tries to protect the perpetrator because he's bringing
paying the bills.
That's just a very yeah. So that's the unfortunate. You have on one hand this mother, this 4-year-old who wanted to take it to the end, and then you have another mother who is willing to do the opposite.
No, but maybe because that 4-year-old can manage. That 4-year-old parent maybe can manage.
Yes.
Can manage on her own. That is the reality of the whole situation when it comes to finances.
Yeah.
But I wanted to just to address the process. The process is
my job is to write a report. I saw this. If there's something to be taken pictures of, I take the pictures, depending on, and then I refer to SOCA.
So if a child comes in, let's say a child comes in underage, a minor, and is pregnant, didn't cry rape or anything, is there, and the mother just taking the child there because the child needs to be seen. There's no report of anything. You see where the child is a minor. Is there any responsibility of the pediatrician to now say this is a police matter, or you have to leave it alone?
No, my thing is, I would have to take up the medical, meaning I can make the report, but I have to send the child like that. I have to send the child to the hospital. But
no. No. Nothing is wrong with the child apart from the child is pregnant. This is a hypothetical situation. Nothing is wrong with the child apart from the child is pregnant, but the child is a minor.
Right.
Parent or guardian takes in the child. Is there any responsibility of the doctor?
Yeah.
To say, well, this child is a minor, or that is a sole decision of the parent?
It's a sole decision. I can discuss it or whatever.
No, what is it? I want to know what the laws are.
Oh, well.
Are there any laws governing a minor coming in pregnant with the mother or guardian not having an issue with the fact that the child is a minor and pregnant?
Not to my knowledge. I don't, not to my knowledge.
Okay, I just want it for general knowledge.
Okay.
This is really up to the parent or the guardian.
Yeah.
Okay.
They would have to press charges and do all of that story.
Okay. All right. Okay. Any other medical issues that you'd like to touch on that I have not brought up that you'd like to speak a little bit on for the general public? Things that you have seen in your office that maybe, persons don't really know about, or you've seen neglected because we don't know everything. We don't
Well,
know. Parents don't even know what to do when it comes to certain things. Is there any particular area that you think is not being addressed when it comes to children?
well, when you told me we wanted to talk about, well, discuss kids health, I thought about nutrition, their
Right.
diet, the way they
Okay.
eat. Years ago, malnutrition was a thing, but now obesity is more rampant because there's so much junk. So it's a matter of monitoring what a child eats from baby come right up, and then
But
they
then
should
at school, and there's only certain things at school to eat, or do you pack a
be.
lunch?
Yeah, I tried to as much as possible to when they were small, yeah, you send lunch. When they reach high school now, they think they're too, that no mommy, we're not carrying lunch. No. But by fourth form, that did wear off, and they began bringing lunch again because they realized I'm big on vitamin supplements because sometimes based on what is offered, and so we never ever eat a rounded diet, really. And sometimes we might have a picky eater, and so I'm big on and even myself as an adult, sometimes we rush about. I take a supplement every day. Or especially now there's COVID, there's vitamin C and zinc and vitamin D and all these things that they say you must take to keep your immune system up.
Right.
So for your child, depending on the age and stage, yes, the diet, vitamin supplements, exercise, sleep. Sleep. You must get enough sleep.
But a lot of the children are not sleeping now because those devices keep them up.
Yes. But as a parent, you have every right. I'm very sorry. After certain hours, the device stays with me until the next morning. And when it came to like GSAT and CSEC, you didn't. Well, in primaries, my children never had a phone before they reached high school. They just didn't. And in high school, if you do it, the phone was mine after a certain hour. And well, they never had tablets. A laptop, you didn't, or those things you never see it, or the video game, you didn't see it until weekend. So as a parent, you have to put down these rules,
Right.
or else they'll be up till 1 a.m. on this thing, and then you can't get up. And the other thing is that before bedtime, no device for about half. You have to wind down, your
Right.
body thing. You cannot be looking into a phone and then expect to fall asleep immediately. That goes for us too, man.
Absolutely.
Yeah.
Absolutely. Yeah. I can tell you, it does disturb your sleep.
Yes.
It does. And you can be on the phone you can be on the WhatsApp or whatever for hours and don't even realize that hours have flown by.
Yeah.
Mhm.
So
What about diabetes in kids?
that's usually type 1 juvenile diabetes, which is
You see much of that?
not in my practice because I'm in private practice now. But such a child would probably turn up at the hospital because they're just losing weight or they're just being, some other reason. It's not very common, but it happens. And then the mother has to learn now how to deal with it. Depending on the age of the child, the subcutaneous insulin, all the child will learn to give themselves. There's a whole support group for that. And there's only one endocrine pediatrician in the country, which is Dr. Leslie Gabbay.
One.
Yes, one uno.
And who's that?
Leslie Gabbay.
Okay.
At the moment, I mean, nobody has studied it, and me too old now. So
No, you're not. Leslie Gabbay.
Leslie Gabbay, yeah, he's at
And
Hillcrest, right where the Island Smiles is. That's
yes, I know where that is.
Yeah. Leslie Gabbay, endocrine, pediatric endocrinologist.
Okay.
They even used to have a diabetic camp back in, I mean, I don't know how much COVID, but so that the children of the same could get together and, encourage each other, be of the same. Yeah. Because you have to deal now with, if you have a teenager with diabetes, that can be a depressing moment. You can't eat like your friends. You can't have alcohol, Pepsi, sodas. You have to watch what you eat, monitor your sugar. That can be quite overwhelming for a teenager who has other, regular teenage stress. So
Mhm. Absolutely. Another thing that I'd love for you to touch on, I, kids, do kids get lupus, or lupus comes at a later age?
Um,
Because I've met quite a few people in the last couple of years with lupus, and I mean, this is not something that I even heard of when I was growing up.
yeah, I find that it's not commonly diagnosed, not less than 10 for sure.
Yes.
Most times by the time there might have been itty bitty signs, but most times they don't add up until you're like early 20s, young adults. I mean, I had a friend who had scleroderma. Scleroderma is part of the connective tissue. So lupus is a part, the connective tissue disorder. And she wasn't diagnosed until she was like about maybe 18 or 19. But when we were at high school, she used to say, oh, she's allergic to ice and ice cream because when she tried to eat those things, it would stick in her throat. Which to me, the retrospectoscope was just the beginning of the whole thing. But it's just that nothing else manifested at the time. And as she got older, then her fingers would get blue, then she, intolerant to cold weather, and then the whole thing, evolved.
Is
But
there
I think it was early.
is there a test for lupus, or is just the signs and symptoms you have to follow?
No, there are some screening tests. There's several parameters, I should say.
Mm-hmm.
There's mainly this, yes, it's a clinical diagnosis, but there's something called an ESR, which can detect the inflammation, and there's some other tests that can, add up to. But it's mainly, the signs and it's your physical manifestations and your symptoms would pretty much do it. The test is just to confirm now, yeah, that you do have a connective tissue disorder. Yeah.
Okay. Another one that is very debilitating for many and very common is the sickle cell.
Okay, yes,
There are
sickle
some
cell.
of the signs. I could not come off this program without addressing it, because I mean, I've known quite a few people that have passed, quite a few people that live with it. Some people struggling with their child with it, and
Yeah.
so we really need to some signs and symptoms of sickle cell, or that is something that you have to test for. Is it tested? Does anybody test sickle cell?
Yeah, so right now the government does a screening. Every child that is born has a sickle screen done.
Oh, great.
Every child, yeah.
And
Then
that's recent, or that's always been like that?
recent-ish. Recent. The thing is, maybe the last 5 years. It's a very simple thing now. At birth, they use a card blood. They blot it on because they have a paper which has a name on one side, and when the child was born, and the mother's name, and then a part that's like filter paper that does absorb the blood, and then that's taken to the sickle cell unit at UA. That was recently streamlined. Back in the day, like when I was at Bustamante, any child who came in for any other reason, we would just do it. But it wasn't a national thing. But the national thing has been a good while, at least 5 years, a good while. So private, public, anywhere you're born, it's done. Because about 10% might have the trait, I think. Less than that will be sickle disease, but a lot of us have the trait, and the trait can be totally normal. Now, the thing is, there are different types of sickle cell disease. You have, if you understand, normal people have hemoglobin AA. If you have the sickle cell trait, it's AS. But if you have SS, you're fully sickle cell. And if you have S and anything that's not an A, you have a form. It's just that it's not as bad as SS. So you have SC, which sometimes you as people come to this, you can get missed because you're okay to a point, and it's a milder form. And then you have something called beta thalassemia, so you can have S beta thalassemia. It's just S and something else. That's not an A. Now the thing about SS is the worst, because then you have full blown. What happens with sickle cell is that you have sickling. So your blood cells are supposed to be malleable and pliable and be able to go to the tiniest of blood vessels. When you have sickle cell, it doesn't do that. It becomes stiff and sickled shape, which is like a crescent. and then it cannot navigate tiny, or it sludges up in tiny blood vessels, and then it causes pain. So the most common thing, the most common thing for a sickle is to have painful crisis, severe pain, bone pain, deep, disturbing, Panadol cannot fix pain.
Unbearable.
Unbearable. Now, usually though, the earliest it might manifest, we call it dactylitis, is when you're about 6 months. You might get swelling of your digits because that's the earliest presentation. Now, usually as a baby, you don't really present because you have what's called fetal hemoglobin because you're a fetus, from the fetal stage. So you would be a regular normal person would be AAF, and you have this F. But if you have the sickle cell trait, you'll be ASF. And then if you're sickler, you'll have S and F. Then when the F disappear, you only have S left.
Right.
So
yes.
The fetal hemoglobin is what you have as a, while you're in the womb, and then over the first year, the fetal hemoglobin disappears, and then you get the A. So that's why when you're just born, you don't really have symptoms because you have the fetal hemoglobin buffering, so to speak.
Get you.
When that disappears, the earliest, maybe as early as 6 months, but between 6 and 12 months, you might have this dactylitis, which is when it, because the blood vessels in your bone are the tiniest, which is why you have bone pain, because when you get sludging in the bone, then you get the pain. You can get acute chest syndrome, that's chest pain. Sicklers have this thing with the spleen. That's without going through, too much detail. But you can have abdominal crisis. You can have pain anywhere, really. And then because of the sickling, your red blood cells don't live as long as a normal person's blood cells live for 120 days. Every day, you and me have cells that are dying, but your bone marrow is making new cells. But the sickle cells are destroyed much faster. And then if your liver cannot deal with it, the bilirubin which is the pigment in the red blood cells, makes you yellow. That's why sicklers get jaundice.
Get you.
Yeah. And then the other thing is that their immune system is not as sturdy as ours, so it makes them prone to certain infections and so on. So if it is you have SS, the best place for you to be is at the sickle cell unit. So I have a few patients like that, but I co-manage with the sickle cell unit, because the sickle cell unit will see to it that they do their regular monitoring. And this came out of screening at Andrews. So I mean, the parents knew that they had the sickle cell trait each. So by the way, you can only have SS if one parent has the S, and both. You have S from each parent.
Right.
And so the first child was AA, but the second child was SS. And it's just a probability each time, really. And the mother, because she was so very keen, she followed up the results herself, so she could find out from an early stage and just tap into what the sickle cell units had to offer.
Okay. Yeah. So are any of these illnesses with the vaccines that are coming up, is there any contraindication with any of these illnesses with the COVID vaccine?
No.
Okay. So there's no
the only time I would say there might be a query is if you're in the middle, like heaven forbid you try to leukemia. No, you mean the sickle cell? You talking about sickle cell?
Yeah. No. In the crisis of anything, no. Any of the
anything. Right.
Okay.
No, vaccines are there to prevent illnesses. So I'm a strong pro vaccine person. Yeah.
All right. In terms of cancers.
That's not common.
Not common. Yay.
Oh, it's not. I mean, that was the only part about pediatrics that I did not like. When I had a child with leukemia or a kidney mass, and that's a nephroblastoma, or sometimes I had a retinoblastoma. I mean, it's not common.
It's not common. No, I like when I hear it's not common.
Yeah. I mean, I was also common things are common. So when you're presented as a doctor, common things, you rule out all the common stuff first before you get to the weird and wonderful.
Right.
Yeah.
Well, okay. So you said nutrition was one of your the things that came to mind. Anything else
Right.
came to mind?
Yeah,
To
we
tell
talked about the sleep, and we talked about the exercise, and we talked about
you're gonna exercise.
um,
Yes.
vitamin supplements, and
What are some of the vitamin supplements that you recommend?
well, I like a multivitamin with vitamin C in it. The vitamin C is for and
Mhm.
people like me and you grew up on cod liver oil. Can I tell you?
Yes.
So my child got both.
Mhm.
Um, Rarely you might have to do iron supplements, like babies who are born prematurely, because if they come out too soon, usually in the latter part of the third trimester is when the iron stores get laid down.
Mhm.
So if you have a child that's born too soon, then you have to give them hemofed as well as a multivitamin.
Mhm.
Or if they had any major crisis or major, that would have impacted their blood count. Because now, a lot of the formulas are fortified with iron. So if you are good on the nutrition aspect, you will not be anemic, really.
Mhm.
Basically, yeah.
So all right. So give us, all right, as we wrap up, give us some of the general. Give us like 5 top general things that parents need to be doing in terms of where their kids are concerned. Okay, you said every year a child should get checked up. I remember that one, right? So every
Yes,
year, whether whether the child is sick, yes or no, you're taking the
yes,
child to get
yes,
checked. All right, so that's one out of the 5. Okay, so that is one. You
yes,
said definitely the sleep.
yeah,
Ensure that the child gets sleep. Take away the devices at least an hour before going
yes.
to bed. Monitor the use of the device, because I know
And
that
then with the online thing now, that is real, yeah, yeah.
they're on it for school. So you need to limit some of the playtime on the
Right,
device, because
right,
then because they'll be always on the device.
yeah,
So you need to monitor the device use. Um, take vitamins, multivitamins with definitely vitamin C in it.
yes,
Exercise.
yes,
Um, in terms of um, diet, I know us older folks, they tend to say, cut out the rice, cut down on the meat. Is there any particular advice for growing children? 'Cause I know the needs are different.
yeah. I would say feed only when you're hungry.
Mhm.
Sometimes we have this fat baby syndrome. The more the child eat, the better. I mean, grandmothers feel like doing their
Auntie,
whole, yeah, man, their whole aim is to make sure that child is big and
have
fat
it,
and strong. Yeah, yeah, yeah. So,
please.
and eat at the dinner table, not in front of the TV, not with your baby. Eat. I mean, family time, it has totally evaporated now, I find.
When last you see a child at the dinner table?
Well, let me tell you, even as big as my children are, I tell them Sundays are sacred, okay? Sundays, at
Mhm.
least because now they're older and the schedules change. But Sunday, if you make appointment and
Everybody grab a plate and goes into the bedroom.
no phones at the table on a Sunday. The online thing again, sometimes, yeah. So in the week, it's hard to the family thing, but
So that's
Sundays.
another thing. We need to get back to the family structure.
Yeah. When my children were
At the
smaller,
dining table.
yeah, when my children were smaller, we had dinner. It was, the father might be later, so about me and the kids. But now
Yeah.
that they're older, I have to apply for the Sundays. So yes,
Ah,
yes.
I like what you
But,
said. You apply you have to apply for
but
it.
if
I
you
like
train them
it.
up, early, they'll recognize. And I'm telling you, what will happen on a Sunday? Even if one child is hungry, the child come and sit down because I don't want to eat alone. So one of
Mhm.
them will be hungry. So I try to figure out which one ready. The
Mhm.
one that don't ready yet, come and put the body right there. So and we have a conversation. Catch up.
So go
And
back
that's
to
how we
eating
do
at the
it.
dining table. Yeah, because that's how you catch up on what happened in the week or happened
Yeah.
in the week.
You,
Yes.
you
That
can't
is
catch up in front of a TV. All of you sit down eating in front of the TV, there's no interaction.
Absolutely.
No.
I am in total agreement. When I go to my girlfriend's house, I see everybody sit down at the dining table, and it's so refreshing. I mean,
Yes,
you know,
man.
mother, father, children, and we have a good conversation. And it's
Yeah.
always a pleasure, to sit down and have a meal, and it's a different feel altogether.
Yeah.
And you really do catch up. You really
Yeah.
do catch up. But I think a part of the challenge is that the devices keep the children busy,
Yeah.
so the parents can do what they want to do. And that's a major part of it.
Yes.
They go
Yes.
to work, they come home, they want to fix dinner, they want to do everything. They have
Yes.
several things doing.
Yeah.
Work a single parent, that's another
Yeah.
on top of that thing. So they sit down at the table, to schedule that together time is just not
Yeah.
there. You really have
Yeah.
to push
Have to
and,
make an effort.
and make the effort to make it
Right.
happen.
Right.
Anything else that you want to put in your top things?
Always checking on your child's mental states. Children worry about stuff. It's always good to ask, how are you doing? How are you feeling? Sometimes children can't define their emotions, but you have to help them to figure it out, Is anything bothering you today? How was school? Even if we talk about friends or whatever, because sometimes it's a death in the family and it's bothering the you don't know. And anxiety is a real thing. So, and children, they might not say anything, but they will worry about it, or they will say, "Oh, like the heart hurting them." No, the heart's kind of, but maybe grandma did die of a heart attack, and they feel like a chest pain, and they worry if they are going to. So,
Oh, I see.
you have to, once a week or when you get, have a little powwow time, and if you have more than one children, you have to do it individually.
But as a group event, because they won't necessarily want to speak about what's bothering them in front of the others.
Yes, yes.
I get you.
Truly,
I get
truly.
you.
Yeah.
I get you. Anything else? Let me see. It
Well,
says,
always. I was always one who also checked in with what they do, how they doing at school.
Mhm.
You must know how your child. I mean, I was a very involved parent, so when my children were doing GSAT, I was the extras. I mean, not many people might have the time, but I discourage you just shunting them to extra lessons. Find out where the weakness is and tap in, because sometimes if you just send them, they're just being flogged with more than what they might need. Maybe the weakness is just English. They don't need to go to math extras too, and then it makes the day so long, and the children are so you need
tired, brain tired.
Yeah. I mean, I remember one fellow parent telling me, "Oh, the child already did the extras, but she has sent her anyway." I'm like, "Why? If your child, why are you doing that?" So,
Overkill.
so if your child has a weakness, you have to find out, and that goes through till college, really. Yeah. And I'm here to advise parents to save for college, because it's coming, and when it lick you, find a way to put away a little. It might not come all, but it's a little buffer. Yes. Yeah. And always be your child's biggest cheerleader. Be your
Yes.
child's biggest cheerleader. You don't know what you do for that child when you're in the corner. I'm telling you. I could write
And
a book.
what you do when you say, why you can't be like so and so? Why you can't be like?
Don't do that. Don't. Even between your if you have 3, do not do. Please don't. That's the worst thing.
Worst ever.
Yeah.
Worst
Tell them that
thing ever.
you're in your eyes. You're the best of
Comparison.
whatever.
Yeah.
Yes. Yeah.
The comparison stuff.
Oh,
Well, yeah. Anything else?
wait. For those of us who will listen,
Yes.
I have a quote from the Prophet Khalil Gibran. This is on children. It's just a few choice words. So for those who will listen, okay. So this is just a few paragraphs. And a woman who held a babe against her bosom said, "Speak to us of children." And he said, "Your children are not your children. They are the sons and daughters of life's longing for itself. They come through you, but not from you. And though they are with you, they do not belong to you. You may give them your love, but not your thoughts, for they have their own thoughts. You may house their bodies, but not their souls, for their souls dwell in the house of tomorrow, which you cannot visit, not even in your dreams. You may strive to be like them, but seek not to make them like you.
Absolutely.
For life goes not backward, nor tarries with yesterday. You are the bows from which your children, as living arrows, are sent forth. The archer sees the mark upon the path of the infinite. He bends you with his might, that his arrows may go swift and far. Let your bending be in the archer's hand. So you are the archer is God. So let
Right.
your bending in the archer's hand be for gladness. For even as he loves the arrow that flies, so he loves the bow that is stable. So you are the bow. You are to be stable. You are shooting the arrow, and your job is to give your children wings so that they
Right.
can fly. So that when you're
Absolutely.
gone, they will be okay.
Absolutely.
Yeah.
And with that, we say thank you, thank you, thank you. Tell us where we can find you.
Oh, I'm at Winchester Surgical and Medical Institute, 3A Winchester Road, opposite Bureau of Standards.
Is there a number?
Oh, the office number is 9061256, 876-906-1256. And the work
And
cell,
you're open Monday to Friday?
Monday to Fridays, and Saturdays half day. I share the Saturdays with somebody else, but yeah, I'm there every day in the week, starting at 10 o'clock.
Okay. All right.
Yeah.
So somebody says, love you, Doc. You are a gem. Sislin Joseph Johnson.
I know her. Yes. Thank you. Thank you. Thank you.
Yes. So I want to thank you again for joining me. You gave us quite a bit of gems. I'm sure our audience learned a few things this evening. I certainly did. So I just, you answered as usual very quickly. Although I wasn't expecting a no, really. But I just really want to say thank you so much for giving us our 23 minutes of your time. We really appreciate it. Thank you for doing what you do and continue to do what you do.
Thank
Friends
you.
Friends and family, thank you for joining us tonight. I hope you also learned something and got some good information. She gave us a few places also in case you're having issues with your kids where you can go as well for special what did you for developmental
Right.
for
Right.
developmental specialists.
Right.
Thank you so much. We'll be back next week, same place, same time, 8 p.m. Jamaica time. Have a fantastic week. Please remember, although the place open up back, COVID still a keep.
Mm-hmm.
I have taken my vaccination. For
Me
those
too.
who want to take their vaccination, please go out and have your vaccination so we can get back to normalcy as quickly as possible. Thank you so much for joining. See you next week. Good night. Have a good night.
All right. Bye.
Bye, Doc.